Good afternoon, everybody. My name is Mario Stark. I'm the CEO of Vivior, and I'm very happy to be here at this OIS Innovation Workshop. I've been in medical technology for decades in different areas: orthopedics, robotics, spinal care, diabetes, and now for over 5 years in ophthalmology and vision care. And I'm very happy to talk to you about Vivior and explain to you who we are and what we're doing. Let's talk about Vivior. At Vivior, we really want to help eye care professionals to get the best vision correction to their patients. And what is most important to us, to really personalize the vision correction to improve the performance. And as we all know, we have great tools for that. We have IOLs, we have contact lenses, spectacle lenses, laser corrective surgery, and a lot of other procedures to actually get the best vision correction ever to the patients. And we want to support you in that. And there are some issues. I mean, we have children with myopia, we have productivity loss due to bad vision. So it affects a lot of people's life every day. And that's why I would also like to introduce you to one person that is going to be affected by these issues with vision. Let me introduce you to Emma. Emma is not an invention by Vivior. It has actually been developed by the BBC. And it's a projection how the average office worker could look like 20 years down the road. So she or he will have issues from bad posture because she is sitting a lot, swollen wrists and ankles from the strain, and of course also issues with their eyesight, red eyes, itchy eyes, dry eyes. So there's a lot of things that can go wrong if you work too much, too many times on your computer, on your office screen. So we have developed an approach that really helps eye care professionals to prevent these kind of things. And we're looking at a combination between what we like to call eye health and visual behavior. So when you talk about eye health, we're talking about there's great technology out there to analyze the eye itself. We have OCTs, we can do topography, we can analyze the cornea, the retina, whatever. So we have everything you want to know about the eye. But another important part to really find the best vision correction is also understand what the patient really needs. And that's what we like to call visual behavior. And currently that is done in a discussion with the patient, with questionnaire or apps. And all this information that we're getting is subjective. It's what the patient remembers, what the patient knows, what the patient guesses. And it's really inaccurate. It can be very misleading, and we want to prevent that. Vivior has developed a system that consists of artificial intelligence on the cloud and a device that we call the Vivior Monitor. The Vivior Monitor measures parameters like distance to objects, light conditions, head position, head movements. And with that, we analyze the patient's needs, the patient's visual behavior, and we can get this analysis available to the eye care professional or whoever is interested in this data. The technology is unique. So the basis is LiDAR, and you might have heard about the LiDAR when you were talking about, self-driving cars. There's this LiDAR system that actually measures distances, and that's the same that we are doing. So with our system, we can really get a scan of the environment. We understand if somebody is working on a computer or driving a car or being in a meeting. So we really can measure the real visual behavior and then make this data available to the interested parties. Practically, how does this work? Vivior is handed out either by the eye care professional or also by HR departments of large companies that want to analyze the workforce. The patient wears it for 36 hours. We recommend 2 days during the week, 2 days in the weekend. The analysis then is available instantly with the support from our artificial intelligence. It's added directly to the patient, recommendations about posture, about your workplace, or recommendations directly to the professional. And these recommendations include that we can recommend the best eye care solution, the best vision correction solution, be it spectacle lenses, contact lenses, IOLs, whatever it is, to the eye care professional. So we address a lot of needs. One, of course, about correction, get the best correction to the patient, about performance, make sure that they can live their life as they want to. But it's also about prevention, of course. We have information about risk factors that can lead to progressive myopia. So you understand if a child is a lot outside, or understand about reading conditions, light conditions. We also have, of course, this application in digital office health where we can prevent the office syndrome. So there's a lot of application areas for Vivior in the eye care and general health environment. Where are we? we are on the market since 2020. We have CE approval since 2018. The FDA has accepted our device as a non-medical device, so we're free to sell in the States. We have 8 patents that we've supplied, and 2 of them are issued. We have 800,000 Swiss francs, that's around $8,000 of revenue, actually since 2020. And we are partnering with companies that have a different view, not only from a visual perspective, but also technology companies that produce and market digital devices like smartphones, computers, etc. Telehealth companies that support remotely patients, insurance companies that are interested to prevent us turning into EMA, as we've seen, and also corporates, large companies, and smaller companies that really want to help their own workforce in the office to get the best workplace arrangement and really increase productivity and prevent healthcare issues. We have an established client base. We have direct sales in Germany and Switzerland. We have over 80 customers in those countries. We have a network of distributors worldwide, and we are looking for partners to support our US expansion. So that's Vivure. Thanks a lot for listening, and I'd be happy for any questions or comments in the Q&A session. Thank you.